All right, so this is part 2 for your pharmacology, chapter 9. We're picking up on slide 25. So, looking at other COPD therapies, so phosphodiesterase 4 inhibitors. These are used to treat emphysema in patients that have the alpha 1 antitrypsin deficiency. So, patients that have that deficiency have an increased risk of inflammation and then an increased risk of destruction of the alveoli. It prevents the additional leukocytes and neutrophils from infiltrating the lungs, which also help in prevention of destruction of the rest of the alveoli. Side effects of these particular class of drugs includes headache and dizziness. Mucolytics, so a mucolytic such as acetylcysteine, or you'll hear it be referred to as mucomist. These are used to destroy and dissolve, mucus. So we actually, in a hospital setting, because the acetylcysteine comes in a injection vial, so a glass vial, we have to draw these out into doses, into oral syringes for the respiratory therapist, because they use this in nebulizers for patients to inhale, patients that have COPD, that have cystic fibrosis, to help increase and dissolve out that extra mucus in the lungs. Combination products. So these combination products do contain the long-acting beta agonists. It helps improve adherence because of the ease of administration. So combining some of these medications into one helps the patient not have to take so many or so much throughout the day. They have the same side effects, the same contraindications and cautions, and also drug interactions as the individual drugs do. So that's something that you have to be aware of as well. So other lung diseases, pneumonia. Is a lower respiratory tract infection affecting patients of all ages. We know that is one of the biggest risk factors for the COVID-19 or the coronavirus that we're seeing, and that's actually what's causing death, because it then causes respiratory distress syndrome. So it's attacking the lungs. So aspiration pneumonia involves inhalation of fluids from the mouth and the throat. So this is common for people that overdose or drink too much alcohol and pass out. They throw up, they're not conscious, and they inhale that throw up back into their lungs. Community-acquired pneumonia, known as CAP, means you have come in contact with a bacteria that causes pneumonias outside in the community, from the grocery store or wherever you've gone. Nosocomial pneumonia means you acquired it while you were hospitalized, so you acquired it from the hospital facility or other type of facilities like rehab facilities, long-term care, nursing homes, those type of things. These are typically severe. They can be more severe, typically are more severe, and they're typically more difficult to treat because the bacteria that you're coming in contact with in the hospital or in these long-term care facilities are typically starting to become resistant to drugs. So these bacteria are more drug resistant. Cystic fibrosis is a hereditary disease that involves both the pulmonary and GI systems. There's a testing that they do for women while they're pregnant to see if the baby does have cystic fibrosis. And that's just a decision that has to be left up to the individual. Pulmonary manifestations of cystic fibrosis, so hypoxia, cyanosis, digital clubbing, fluctuating of lung function. Percussion or tapping induces cough and expectoration of mucus from the lungs. Before the campus closed, quite a few months before that happened, we had a group of middle school students that came through that were kind of doing a tour, and I was able to be a part of one of the tour groups, and I got to actually put on a percussion vest that they use to for these patients, and it really shakes you. It's a percussion chest vest that shakes your whole entire chest, and it feels like you kind of have someone beating from the front and the back. And they had you try to blow bubbles while you were doing it. It was pretty interesting, but those are designed to help break up that mucus and get it out, because in cystic fibrosis patients, they have an excess production of mucus, not only in the lungs, but also the GI system. Bronchodilators, hypertonic saline, and acetylcysteine, which we just talked about in the mucomist, is also used to liquefy the secretions and get them out. The GI, or the gastrointestinal manifestations of cystic fibrosis, is they will get a bile duct blockage within the intestines because of the excess production of the mucus, and the mucus being so thick. And most cystic fibrosis patients have a deficiency of pancreatic digestive enzymes, which are necessary for our body to be able to break down the food in our systems, in our intestines. Cystic fibrosis. So typically if we have a patient that is coming into the hospital for various reasons, their cystic fibrosis patients are very prone to pneumonia and other type of respiratory infections. So we'll put them on various antibiotics depending on what the suspected organism or bacteria is. They can nebulize antibiotics. So for example, if we know that it's localized into the lung, there's certain antibiotics that we can actually turn and use into a nebulizer, so it's directly inhaled into the lungs instead of administered via IV, where it goes all over the body system. Mucolytics for cystic fibrosis, again, are used to decrease the secretion thickness to allow it to get out. And then we give them a pancreatic enzyme supplementation. So it's called pancreolipase, is one of the names of the drugs. So it contains lipase, protease, and amylase, which is used to help break down the food, which will help prevent any of those obstructions. Respiratory distress syndrome is a disease of inadequate production of pulmonary surfactant and